Good morning. This is Makiba of melissasource.com. And lung cancer is one of the deadliest forms of cancer, causing more deaths
That's correct.
every year than prostate, breast, and colorectal cancer combined. However, cancer experts are researching potential ways to harness the power of the body's immune system to help fight cancer. Joining me now from Chicago are lung cancer expert Dr. David Spigel, director of the Lung Cancer Research Program at Sarah Cannon Research Institute, and Stephen Young, president and COO of the Addario Lung Cancer Medical Institute. They're going to talk more about lung cancer and the current needs of the patient community, as well as reveal the latest research advancements. Good morning, gentlemen. Thank you for joining me today.
Good morning. Thank you for having us.
Now, first, doctor, please share with us, why has lung cancer been such a difficult disease to diagnose and treat?
Yeah, it's a great question. I think there are many reasons for that. A couple of the reasons would be that lung cancer, just its very nature, is it tends to be an aggressive type of tumor, a cancer that can spread early. And the other thing, and it's related to that, is that when we find out about cancer, often it has already spread. And so that takes away your opportunity to do things to try to cure patients, like cut it out with surgery or treat it with radiation therapy. Those are still possibilities, but they become less likely when it's spread.
Yes, absolutely. Now, Stephen, please share with us, what is the current landscape for patients with lung cancer?
Well, I come from a patient-centric research organization, and we see many patients. And our survivor, Bonnie Addario, is now a 12-year survivor, and she started 2 foundations. When Bonnie was diagnosed in the mid-'80s, at that point she was told to go get her affairs in order. And for decades, many lung cancer patients were hearing that. That's not the case today, thanks to the research done by fabulous researchers around the world, including Dr. Spigel. We're at a stage where patients can live and actually defeat their disease. And that's due to the fact that the scientists and researchers are better understanding the cancer and, of course, also moving therapeutics and diagnostics forward so that we can find the disease earlier and then customize treatments to each of us as patients. So I'd say it's a sense of optimism and grounded hope, meaning we really understand the disease and there are some effective therapies out there. And as Dr. Spigel will tell you, there are some really impressive results coming out, particularly at this meeting and over the past 2 years.
Yes, hope indeed. Now, doctor, can you share with us, what is immuno-oncology and how is it different from other current lung cancer treatments?
Sure. Immuno-oncology is a bit of a complicated term there, a bit of a mouthful. Another term you might be hearing a lot about in the near future is immunotherapy. It all describes really a simple process of trying to use medicine to boost your immune system to fight cancer. We all have immune systems used to protect us from everyday threats, so to speak. Cancer is something that has figured out how to fool the immune system. What we're seeing now is that there's a wave of medications that can wake the immune system up, fight the cancer, control it, and allow patients to do better. And as Stephen was pointing out, we heard specifically about one medication this weekend that was quite successful in lung cancer.
That's very interesting. Now, also, doctor, please tell us about this research that you recently presented at the 2015 ASCO annual meeting.
Right. So we looked at patients who had lung cancer that had already received chemotherapy, and unfortunately that cancer was still growing. And we just wanted to know, would immunotherapy, in this case a medication by the name of nivolumab, a medication you can get in your own community in the outpatient setting, whether that would be better than chemotherapy. And what we showed at this meeting was that it was better. Not only was it better, we had a near doubling in the chance of living if you received that immunotherapy compared with chemotherapy. In addition, the medication was very safe. There can be side effects with immunotherapy. Things that boost your immune system in theory could cause side effects, but those tended to be very low, very manageable. And if you look at all the side effects related to all these therapies, it's far different, far lower than you would see with chemotherapy. So what we're seeing is a medication, in this case nivolumab, that's allowing patients to live longer and actually live with less symptoms that they might experience if they had received chemotherapy.
That is absolutely amazing news to hear. Now, Stephen, how important is this research to the lung cancer community?
There's no possible way to overestimate how important it is to patients to hear these and see these drugs and success stories. As I mentioned before, it's not a deadly disease. It is still a very deadly disease, but there are many patients that can beat it. So I would say this kind of result is resulting in patients understanding how important it is to when they evaluate themselves and see themselves not feeling well, to go to their doctors, but more importantly, not to give up. There are ways to fight this, and patients are winning every day. And an important part of this is many people don't even think about lung cancer. If they do, they try to ignore it. The reality is, as you said early on, it's by far the biggest cancer killer. And another big unknown is about twice as many women die of lung cancer than breast cancer. So many folks, particularly in their younger age, sometimes ignore their symptoms or misdiagnosed. So I would just encourage patients to be very aware of their bodies and their health and health symptoms, and immediately approach their doctors. And secondly, to go and get second, third opinions, and also to educate themselves. There are websites that can do so. Our foundation has a website, lungcancerfoundation.org, which is a great resource for patients to learn about their disease, and as importantly, what kind of therapies and kind of questions to ask their doctors, and so that they have best outcomes.
Absolutely. And then lastly, doctor, what should lung cancer patients or caregivers do to learn more about immunotherapy or the treatment options?
You know, it's a great question. There's so much coming out, so much excitement with news that's just been released in the last few days. I think the first place is start with your doctor, your healthcare team. They're going to be the best resource for you. And if they don't know the answer that you need, they'll direct you to the best place.
Yes, thank you so much for that. Now, while it is a fact that every 3 minutes, one person in the United States will be diagnosed with lung cancer, this latest research from the world's most prominent cancer meeting may have a promising impact on the cancer community. To learn more information about this research and the latest advancements, be sure to visit your doctor. Thank you so much again for joining me today, gentlemen.
Thank you.
Thank you for having us. Thank you.